Hi everyone, today we are going to see an OIT letter. So this is Mrs. Jane Lapaglia. So this is a letter. Wait a minute. Okay, so this is the thing here. You are a charge nurse on the medical ward where Miss Lapaglia has spent most of her hospital stay as patient. So Miss Lapaglia, so I think it is Mrs. Lapaglia, yeah, it is addressed as Mrs. Spend some time in your hospital, and she might have spent some time in the emergency department. She might have spent time in the ICU sometimes, maybe in the observation ward. But most of the time she spent in the ward, which you were working as a charge nurse. So that is the thing here. So most of the time, so most of their hospital stay, it means she was there in some other departments. Now, using the information in the case notes, you have some information in the case notes. Write a referral letter to the charge nurse at Boronia Nursing Home, Kogi. So she will be discharged from your ward. So you have been taking care of Mrs. Lapaglia for some months, maybe some weeks. So right now you are going to discharge her to a nursing home, and that nursing home name is Boronia Nursing Home, and that you are writing the letter to the charge nurse of the Boronia Nursing Home, Kogi. So you are going to transfer the patient to this particular nursing home. Let's see in detail what is happening here. Now, we can say that the patient name, it's very important, Mrs. Jane Lapaglia. Aged, she's aged, that's 71 years. Now, I don't need that she's is from an Italian Catholic background and speaks only functional English. I don't want this particular information. So admission date, I just want to go ahead with admission date. That's for March. And discharge date is also very important there. So we have name, age, admission date, discharge date. Now this is what the area we need to have more concentration. Just want to say that the patient has the primary condition. The reason for her admission was renal failure secondary to dehydration. This is the thing you need to concentrate. So why she got admitted to the hospital you were working with is that she had a renal failure. So this is a primary reason for her admission, and the treatment you have given there at your hospital was primarily focused on this particular thing. So we need to say that this is, we need to see this as the primary reason for admission. The focus should be given here on renal failure. And you might ask me that whether she had pneumonia and we have not given, had we given a treatment for pneumonia? Of course, we have given treatment for pneumonia, but we need to understand that pneumonia is a condition which occurred to her during her hospital stay. It was hospital-acquired pneumonia. So she came with renal failure. She was there in our hospital, and later she was diagnosed with pneumonia. It was hospital-acquired pneumonia. There was mild dementia that was there. It was there with her. Of course, it was a patient. She was a patient with, she was a dementia patient. Right. So this is the diagnosis. The primary condition. Then she got pneumonia. She had dementia. That was mild. That was not, no, two conditions are there. Primarily, one is renal. The second, we need to focus on pneumonia, but let's see how to do that. And now we have the social medical history. Now I may need it, sometimes I may, keep in mind. But I definitely need this thing. So this coping mechanism is not good for job. Now, house dirty, poor hygiene, nutrition may or may not need it. One son Andrew, now that's not much needed. Classical music, ballad, AFL, now I don't think that is not that much relevant there. Still I can keep in my mind. So one thing is very important, that the patient's husband, Joe, is not able to take care of his care. Now this is something relevant here. Now see doctors notes to be forwarded. So medical history and medications. You can say that at the end, if you need, you can say that of not. At the end, you can add like that of not the medical history, the medical history and medication records are to be forwarded. Okay, so then that's it. When we move ahead with the next page, you can see that how was she managed there. She was initially comatose, so she was unconscious, and she was on ventilator for almost 7 days a week, and was given dialysis for the 3 weeks, which reduced her urea and creatinine back to normal. So now she has hospital acquired pneumonia, and she was given physiotherapy, and she requires it for another 2 weeks. So it was given clear, physiotherapy clear, still require oxygen 2 liters via nasal prongs, non-infective for 352. So now, when though chest physiotherapy given this pneumonia has been solved right now, to maintain her saturation level, she needs oxygen via prongs, via nasal prongs after discharge too. Now confusion post ICU, but now back to usual mild level and quite settled right now. So when though she had some disorientation, right now her condition is stable. Needs prompting to eat, drink, dress, walk, toilet, and tend to personal hygiene, but can independently do this. She is able to do all these things, but right now she needs prompt because she has mild dementia. That is the reason. Now, that is her condition right now. She has recovered from the renal failure. Right now, her urea creatinine level is back to normal. Pneumonia is okay, but she needs oxygen. She has some mild confusion and dementia, so needs prompting. So this is what her condition right now. And now she is when she is ready for discharge, they have asked about the social background. When they have assessed the social background, we can see that this person who is living with Mrs. Lapaglia, that's Joe, that's her husband, and he is not able to take care of his own needs, and he won't be able to take care of his wife too. So this is the condition. For this condition, we have held a family conference on 25th and decided to move the patient to the nursing home and her husband to the adjoining hostel. But we found that the beds for Joe and Lapaglia was not there available. No beds are available on till today. The day of writing is on 28. Till today there was no. No, nothing was there. No beds were available. So this is the condition here. Now today we are going to transfer these two, both Lapaglia and her husband to the adjoining hostel. So you are not going to write about Joe, that you are not directly responsible to take care of Joe, but you are directly responsible to take care of Lapaglia. Now let's see what she needs. She needs oxygen therapy continuation, now independence, self-care, prompting, adequate hydration, electrolyte, urea, creatine test weekly. So this is the requirement. So let's see what is going to happen in the introduction of this thing. The date of writing is 28 April 2011. The charge nurse, Boronia Nursing Home, Hugi. Dear nurse, because I don't know the name of the nurse, that written nurse. Reference Mrs. Jan Lapaglia, aged 71. I'm writing to this letter to introduce Miss Jane Lapaglia, who requires further care and management. She underwent the treatment of renal failure at our care, secondary to dehydration, and is being discharged to your facility today. So we are not going to, we have not written pneumonia, dementia, all the diagnosis we have not written. So it's included there in the body paragraph. So primary things we have, that's renal failure. Renal failure secondary to dehydration. For that reason, she came to our hospital for the treatment. Now that is what we have discussed here. So you don't need to write renal failure, dementia, and what do you say? One more thing was there. Yeah, pneumonia, hospital acquired pneumonia. So that's the thing. Now she is being discharged to your facility. Now Mrs. Lapaglia was admitted to our hospital with the complications of the aforementioned condition. So I have connected this thing with the complication of the aforementioned diagnosis or condition. That was a renal failure. It's not diagnosis. It's a condition. It's a disease condition, the renal failure. So with the condition, with the complications of aforementioned, and she might have, I've not seen those conditions there. So with the complications of these conditions, she came to the hospital. And on which date? That was on 4th, admission date was on 4th March 2011. She was in coma, she was unconscious, and was supported with ventilator for the whole week. So 4th, she got admitted, 5, 6, 7, 8, 9, 10, 11. Up to 11, she was there in the ventilator. She was supported by the ventilator. In order to reduce the urea and creatinine levels, dialysis was performed on her for the 3 weeks, which brought the levels back to normal. So we had her urea and creatinine level abnormal at the time of admission. So what we have done is that we have given dialysis for the 3 weeks after admission. And what happened is that it was brought back to normal. She developed pneumonia during her hospital stay, for which she was supported with oxygen and was given chest physiotherapy. So pneumonia. She developed pneumonia during her hospital. So that was the thing. Now, hospital acquired pneumonia, that's what we have written. She developed pneumonia during her hospital stay, for which she was supported with oxygen. That was a primary care, oxygen support, and was given chest physiotherapy. I can say for 2 weeks, because it was given for 2 weeks. Okay. Okay. So she was supported with oxygen. If I add this particular thing, 2 weeks, for the 2 weeks, I may think that I have given oxygen also for 2 weeks. So I just cancel it because it creates some confusion. We know that the physiotherapy was given for 2 weeks. But the oxygen is still, we need the support of oxygen here. So the thing is that we have written in the part here, continuation of oxygen therapy. So it is there. So while in hospital, we were supported with oxygen. So from the beginning till the end. So how long I have given oxygen was not mentioned there. Still, you need was given chest physiotherapy here also. It's mentioned that it was given for 2 weeks. So I have I don't need to write 2 weeks. For 2 weeks, I have given physiotherapy. So the physiotherapy is not continued here. So it's understood that only oxygen therapy we need to continue. Although she is independent in doing her personal routines, she needs prompting as she has mild dementia. So she has mild dementia, and that's why she needs prompting to do her personal routine. She is able to do that thing, but she needs prompting because she has confusions and she has a mild dementia there. Now, let's go ahead with the social history. Her husband, Lapaglia's husband, Joe, can neither take care of his wife nor himself. So he cannot take care of himself nor his wife. So neither take care of his wife nor himself. Hence, family conference was held on 25 April, and the decision was to move Mrs. Lapaglia to your facility and Mr. George to that Jason hostel today, as soon as the beds are available. In the case not, it is said the beds are not available till 28th of April. So whenever you get the bed, that time we will be discharging these patients. One is Mrs. Lapaglia is coming to Baronia nursing home as the beds are available there. Mr. Joe is moving to the adjacent hostel. So that also is been done today. Would be appreciated if you could accept Mr. Lapaglia and provide her appropriate care, including the continuation of oxygen therapy and support for personal care with prompting. So we need appropriate care. You could accept Mrs. Lapaglia. You could accommodate Mrs. Lapaglia into your care and provide her with appropriate care and continuation of oxygen therapy, support personal care with prompting. She also needs proper hydration to prevent recurrence of renal failure. So in order to prevent the recurrence of renal failure, she needs proper hydration. Kindly perform renal function tests. Okay, test. I think it is tests on her at regular intervals. So we need to go ahead with urea, creatinine, and electrolyte levels. That's what we collectively call as renal function test. At regular intervals, we need to go ahead with that. If you have any further queries regarding Mrs. Lapaglia's condition, please do not hesitate to contact me. And it's written, yours faithfully, registered. No, it's not sincerely. You don't know the person's name, so it is faithfully registered. Hope you must have understood this thing. It's a sample letter. Please don't consider this as the most perfect letter. Okay, so it is just to make you understand this. In this way, you can frame a nice letter with a proper purpose and content. All the writing criteria are somewhat met here, so it's a better letter. You can just go through with it. Okay, thank you, and thank you one and all. Have a nice day.